In May 2013, the Dental Ambulatory Surgical Center became the first UNM Medical Group clinic to earn accreditation from the Accreditation Association for Ambulatory Healthcare.
Being the first clinic here at the medical group that went through that process, I think it was a learning process not only for our staff but also for the medical group in total. You know, I know that all medical centers have some sort of quality programs, but this really formalized it from an outside agency.
Receiving accreditation allows for the appropriate billing of services, and it shows the community that the dental ASC is providing the highest quality of patient care and safety.
For dental, we're lucky enough to be the only AAAC accredited dental surgery center in New Mexico and one of the few in the country. So for the dental community, it shows doctors out there, referral partners, the standard of care that we have for our patients.
To achieve accreditation, the dental ASC had to review their processes and policies and procedures to ensure all AAAHC standards were being met.
They looked at every aspect of the clinic and how every little thing is done, and they put a process in place to address how things are cleaned, how things are stocked, every aspect of patient care.
They did learn that they didn't have a lot of things documented that they thought they did. So we had to really set up a plan of what needed to be created, what needed to be tweaked, and then they needed to look at their processes that went along with those documents.
Once the documents and policies and procedures were in place, training was provided to staff and providers. Then mock surveys were conducted, and eventually the AAAHC conducted a real survey.
You build up all this anxiety of the inspectors coming in, the surveyors coming in, and they were very relaxed. The one thing that I like about AAAHC is that they're clinicians. So it's the kind of accreditor that's been out in practice.
They learned through the process that this is what I do every day. This isn't something that's scripted. I do this work every day, and when they ask me the question, I just explain it.
The site visitors are just saying, show me what you do. How do you treat patients when they come through the door? How do you treat patients when they're receiving care? And how do you treat patients after the fact? And I think that's really what the process is.
With other UNM MG clinics now on the journey to accreditation, what advice can the dental ASC provide?
Just take a deep breath and know that this whole journey is going to make your clinic a better clinic. It's going to make you a better provider. And it is so worth it. I mean, you can just, after you've gone through this, you can really hold your head high and just give yourself a big pat on the back.
Once the staff took ownership and realized it was a good thing and that it wasn't anything to be afraid of, I think that's when it became really successful. And at the end of the day, I think when we achieved accreditation, the staff was really proud, and I think it really was a morale builder in the long run for the staff to achieve this goal.
You'll be amazed how more refined your processes are, and that refinement alone just makes everything go easier. It makes the clinic run a little smoother. And when you step back and you're done with the journey and you look at it, you think this was really a journey worth taking.